You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lay Miller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. There is a lot that women never learn about their own sexual health and pleasure. Traditional sex education tends to focus on things like pregnancy and STI prevention, while topics like the clitoris, orgasm, sexual pain, and vaginal health often receive little to no attention. As a result, many women are left to figure these things out all on their own. So in today's show, we're revisiting a classic episode from the archives that covers some of the sex advice that every woman should know. We'll discuss how to make vaginal intercourse more pleasurable, what to do about sexual pain and difficulty reaching orgasm, what you need to know about vaginal health and hygiene products, as well as how to reduce the risk of vaginal and urinary infections. My guest today is Dr. Rena Malik, a board-certified urologist and sexuality educator. With over 300 million views and 2 million subscribers, her YouTube channel, Rena Malik MD, has become a go-to destination for frank, evidence-based discussions of taboo topics. Men's Health magazine named her as one of the top 10 health influencers in 2023. Dr. Malik specializes in sexual medicine, female pelvic medicine, and reconstructive surgery. With a prolific portfolio boasting over 80 peer-reviewed publications, she has contributed to advancement and innovation in the field of urology. This is going to be another fascinating conversation that you won't want to miss. Stick around and we're going to jump in right after the break. If you love the science of sex as much as I do, consider becoming a friend of the Kinsey Institute at Indiana University. The Kinsey Institute is the world's premier research organization on sex and relationships, and you can help them continue the legacy of Dr. Alfred Kinsey, whose pioneering research changed everything we think we know about sex. Visit kinseyinstitute.org to make an impact. Your donations can help support ongoing research projects on critical topics. You can also show your support by following Kinsey Institute on Facebook, Twitter, and Instagram. Thank you for supporting sex science. Hi, Rena, and welcome to the Sex and Psychology Podcast.
Thank you for having me.
Well, it's a pleasure to have you here, and it's nice to finally meet you. You're doing such important work in terms of spreading the word about sex education, because we all could use quite a bit more of it. Let's just be honest.
I completely agree with you on that, and you are doing the same. So thank you so much.
So in this episode, we're going to be talking all about women's sexual health and pleasure. And this is such an important topic because traditional sex ed just doesn't teach women or their partners what they need to know about their bodies, especially in terms of how to experience pleasure. It's something people usually have to figure out all on their own. So let's start with pleasure. Much has been said and written about the pleasure gap with regard to vaginal intercourse. And we know that in a heterosexual context, most men are orgasming most of the time through this activity, but women's experiences with it are far more variable. So a super common question people have is how to make intercourse more pleasurable for women. What can you tell us about that?
Yeah, so you know this well, but 85% of women need clitoral stimulation to climax. And unfortunately, that is not what men and society are taught. Women don't know this necessarily. Men don't know this. And it's partially because of the way lovemaking is portrayed in media, right? It's all penetrative intercourse. Within minutes, people are orgasming, climaxing, and everyone's all hunky-dory. And that's not the reality, right? The large majority of women need some form of clitoral stimulation to climax. And so one, it's knowing that. Two, it's also as a woman, knowing your own body and what works for you. And so that requires some self-exploration and then also being able to communicate that with your partner, right? And while talking to a new partner may seem very daunting, it can sometimes be as much as like, well, what are you into? And letting them talk and then saying, well, I'm into this. This really turns me on. But if you're not at the level where you feel comfortable having that conversation, it can also be nonverbal communication. And that's very powerful. And you'll see that you probably do that already, right? You probably may move your hips one way or move another way. You may move someone's head one way or the other way, just so that it's more comfortable. And you may offer vocal encouragement, right? That, yes, that feels good. Don't stop. Keep doing that, right? You know, the most important thing is communication, whether it's verbal, nonverbal, but being able to actually explain that to your partner will help lessen that gap. And also the basic understanding that the time it takes to climax for a female is significantly longer than a male. So when you look at the average based on studies, it takes a man around 5 to 6 minutes to climax, where it takes a woman around 12 to 14 minutes to climax when she's with a partner. And so there is a gap in time. So you need to spend more time with foreplay. You need to spend more time stimulating a female partner where she likes to be stimulated, whether that's the clitoris or whether that's elsewhere, and ensuring that she gets adequate stimulation for the adequate amount of time.
I think that's all great advice. And it's so true that it starts with first understanding your own body, because if you don't know what it is that brings you pleasure, it's very hard to experience pleasure when you're with a partner. And of course, that communication piece is key. And you're so right that so many people struggle with it. And I'm glad you brought up nonverbal communication, because I think that's often an easier way for people to express to their partners what they like or enjoy during sex, because sometimes verbalizing it is hard, or it makes us feel insecure, or it just feels like too much to do. So there's a lot that you can do to try and communicate and express that to your partner. But it starts first with, again, finding out what it is that works for you. And sometimes that might mean bringing toys into the bedroom during partnered sex. I know that can be a whole other challenging conversation sometimes for people to have. Some men feel a little bit threatened by the idea of their partner bringing a toy into the bedroom, but that's why we need to normalize sex toys, because they can play this instrumental role in terms of helping people to experience pleasure and helping to close that orgasm gap.
Yeah, and it doesn't make a woman or female any less because she needs a toy, right? Like vibration's very powerful. It works more efficiently, more reliably sometimes than other types of stimulation. And so, yeah, bringing it in is just another way to give your partner pleasure. And so like, if you just look at it from the lens of like, we're here to have fun, we're here to have a good time, we're here to have pleasure. And if that means I got to bring toys in to have pleasure, by all means, right? Like, it's not a bad thing.
No, absolutely not. And, I think something that can actually be an easier way to help people bring toys into the bedroom, if that's what they want or need, is to look at couples toys. There have been so many great couples products that have been developed. And when you can bring this toy in and pitch it as something that is designed to boost and enhance stimulation for everyone, sometimes that's an easier lift and just a great way to kind of introduce it for the first time.
Yeah, I love these couples toys. There was a recent post on a Facebook group where like somebody was like, don't buy this toy. I had the fastest orgasm. My partner had the fastest orgasm. It was not natural. And people were like, you don't need to convince me. Like, I got it. Like, like if you look at it from the perspective of like, these things are going to make your whole experience so much more fun for both of you. Like, why not?
Yeah, why not? Now, something that often gets in the way of pleasure for women during sex is because they're experiencing sex as painful. Now, of course, sexual pain is multifactorial. Different people might experience pain for very different reasons. But let's say that a woman consistently finds that sex with her partner is painful or uncomfortable. What's the starting point for dealing with a problem like sexual pain, and what are some common solutions for it?
Yeah, so let's start with the things that are easy to do at home, right? Without a doctor, because sometimes you're not going to be able to see a doctor right away. One is making sure you have adequate foreplay, right? Adequate stimulation. You need to be aroused for a sufficient period of time for lubrication to occur. And so if you're not allowing yourself for sufficient arousal prior to penetration, you're not going to have enough self-induced lubrication, and that's not going to be comfortable. And when you get aroused, the body undergoes these physiologic changes. The vagina widens and lengthens, the cervix moves up and out of the way, allowing it to be more comfortable. So if you don't let that happen, right, because you're trying to get a quickie or you're in a rush, it may be uncomfortable, right? The other thing you can easily do is add lubricants. I think a lot of young people, they find that they don't want to use lube. Like, that's not for me. I don't need it. Like, my partner's wet enough, or I'm wet enough. I don't need that. But like, why not? It's just like a toy, right? Bring it in the bedroom. It's fun. It makes things more slippery. It may alleviate that pain that you're having, right? So that's an easy thing. And then knowing that sometimes you either need to reapply lube or you need to use a longer acting lubricant, like silicone-based, oil-based ones that last longer, versus if you're using a water-based one, which is a large majority, or aloe-based one, you're going to need to reapply. Those tend to evaporate. And so those are two sort of common issues that people may not realize they're having that are causing pain. The other thing is if your partner is very well endowed and it's uncomfortable, specifically when they penetrate very deeply, there's products available. I'm not sponsored by them, called O-Nut, right? And you can put it on the penis. It's essentially like a spacer. It allows the partner to still feel enjoyment, pleasure, despite not penetrating fully the entire penis. And then the female partner is not getting the entire penis. So that can help. Those are easy things you can do at home. Now, other things that can cause pain, there's many of them. So commonly around perimenopause and menopause, estrogen levels drop in the vulvar tissues. This can cause shrinking, thinning, more friability of those tissues, which can make sex painful. So a very easy fix is to talk to your doctor about vaginal estrogen. Now, vaginal estrogen is very, very safe. Very little amount of it is absorbed in the system. As long as you don't have active breast cancer, there's really no other absolute contraindication for it. And so it's very, very safe. It can not only make sex more comfortable, it may prevent you from getting recurrent UTIs. It will prevent these tissues from shrinking and getting thinner, which just like we put lotion on our face, right? It's the same sort of thing. So that's one option. Another option, if you don't want to use hormones, is to use a moisturizer. And vaginal moisturizers are typically made with hyaluronic acid or other sorts of longer acting moisturizers that are not just used before sex. They're used regularly every day or every third day, and they keep the tissues moist, essentially, for lack of a better word. So those are options that you can use easily at home. Also, obviously, adding in lubricant prior to sex can be helpful. And then moving on to sort of other issues, a very common one is when you have issues with your pelvic floor. And I would say a lot of women tend to develop what we call high tone pelvic floor dysfunction. I don't know of a lot of women, but it happens often enough in the patients who are having painful sex. And so what that is essentially just like TMJ, your jaw gets tense because of stress, because of anxiety, and you wake up with headaches. The same thing, your pelvic floor is getting stressed, whether it's from prior trauma, whether it's from stress in your life, whether it's from prior surgery. There's a whole host of things that can cause it, but essentially your pelvic floor is getting tight and tense. It's not relaxing as it should, which means that when someone is penetrating that pelvic floor through sexual intercourse, through penetrative sexual intercourse, it's going to be painful. And so you need to learn how to relax, lengthen, stretch those muscles through pelvic floor physical therapy. And that usually in some states requires a referral from a doctor. In other states, you can just go straight to the pelvic floor physical therapist. And so I strongly encourage people to see one if you can, and even get a baseline evaluation.
I think that's all great information. And I'm glad you brought up the idea that sometimes your partner's penis might be a little large and it might not be a right fit, right? So I've actually written about this on the blog, this concept of genital fit, where it's all about how our bodies line up with one another. And sometimes we're just with a partner where we have that better genital fit and everything just feels more comfortable for everyone. But sometimes you don't have an optimal genital fit. Sometimes, for example, if you have a partner who is very well endowed, you might think that the idea of a large penis or the visual appeal of it is arousing, but then when it actually comes to penetration, it might be physically uncomfortable. As I've said many times before, sometimes your eyes are bigger than your holes, right? And so that can pose an issue, right? And it doesn't mean that you can't be with your partner and you can't experience pleasure with them, but it often means that you have to get creative in how you sexually engage with one another. And it could be getting one of those sort of extender devices that you talked about. It could also be trying different positions. There's lots of different ways where you can try to make your genitalia line up in ways that are just more pleasurable for everyone. But it's just something to keep in mind that not everybody's bodies just naturally line up in a way that just suits everybody to optimal pleasure.
Absolutely. And bigger is unfortunately not always better, right? I mean, I think it's a good thing that that's the case because you don't need to have, I think this is important for all all people to hear, but you don't need to have a large phallus to have pleasure, right?
Nope.
Because as I mentioned earlier, 85% of women climax from clitoral stimulation, which doesn't require a phallus. So if you are in the situation where you have a larger phallus, there are ways to deal with that. If you have a smaller phallus, like it's all about, how you stimulate your partner, and it doesn't require a long or girthy phallus necessarily. And so ultimately becoming creative in the bedroom about what's going to work for you and your partner is really what matters most.
Yeah, so true. And this also has me thinking about the research that I've seen on average vaginal depth. There's not a lot of work on it, but it actually finds that the average vaginal depth is shorter than the average penis length. And so you don't necessarily need a gigantic penis to provide stimulation, right?
No, it's average meets. So when you double that length, right, it's probably around average. So if a woman is sufficiently aroused, the average woman will meet the average man and they will work out, right? But there's going to be outliers on either end. And as you mentioned, the fit may not be perfect.
Let's be honest, navigating the world of libido supplements can be confusing. There are so many different products on the market that make big promises, but finding one that actually lives up to the hype is tricky. Many of the options out there contain questionable ingredients, they're underdosed, or they're ineffective. But what if there was a libido supplement you could actually trust? Let me introduce you to Drive Boost from VB Health. VB Health has a simple mission, creating supplements that work. Their formula isn't a mystery. It's doctor-formulated, third-party tested for purity and potency, and made here in the USA. VB Health also just dropped a new product I'm excited about called Energy Boost. They have a whole range of supplements to support you both in and out of the bedroom. So if you're ready to ditch the shady stuff and choose a libido supplement that's effective and actually works, it's time to check out Drive Boost. Learn more and get yours at vb.health. Visit vb.health and use code Justin for 10% off, or click the link in the episode description. Now, over the course of my career, I think the single biggest piece of sex advice that I've been asked about has to do with how to have an orgasm if you're a woman, or how to make the female orgasm easier. And I'm not surprised by this because when you look at the research, orgasmic difficulties are one of women's most common sexual complaints. So let's talk about it. Now, I'm sure you've probably worked with many patients over the years who have reported orgasmic issues. So what are some common approaches to dealing with this if a woman just has trouble having orgasms?
Yes. So first and foremost is if you have not experimented by yourself, which unfortunately many women have not because of, whatever they're told growing up, that's not good for you or that's not right or whatever. So first is starting to just explore. As I mentioned, the clitoris tends to be a very reliable route, but that doesn't mean that that is sufficient for everybody or that that's going to work for everybody. But usually I tell people to start stimulating there. And whenever you stimulate an area, you want to try a whole variety of different types of stimulation. It could be light touch. It could be very like feathers. It could be firm touch. It could be vibration. The clitoris is not lubricating either. So I tend to recommend a lubricant whenever you're stimulating the clitoris. So that's obviously the first place to start. Now, say you are able to, maybe it's muted, maybe your orgasm is changing. Then you may want to consider adding other erogenous zones that people find stimulating. So that could be nipple stimulation. That could be earlobe stimulation. That could be fingers and toes, but like other types of we know if you look at the brain, the homunculus of the brain, which is when you look at where genital stimulation occurs in the brain, very close to it is nipples, ears, those sorts of things. And so you can sort of explore your own body, take your time, enjoy yourself, right? Like just feel your body and find areas that are more appeasing to you and then maybe add those into that stimulation. Also stimulate in the vaginal canal. So we know that the G erogenous zone, which is about 2 centimeters in underneath the urethra, so at the top side of the vagina, is an area where there's a confluence of nerve endings you can stimulate the clitoral body. So the clitoris goes deep inside the vagina and around the vagina like a wishbone. So you can stimulate that area. There's also the Skene's glands there, which are underneath. And all those areas have really dense nerve endings. So stimulating that area may be pleasurable, maybe both at the same time. And you can find toys that stimulate both at the same time. And for some people, cervical stimulation or deep stimulation into the vaginal canal can also be stimulating. So that may require a sex aid of some kind, whether it's a dildo or something else, to get that deep. But then, exploring and figuring out like what of those areas is causing you to have the most enjoyable climax. And then say you're still struggling, you can try over-the-counter like female arousal gels, and those can be very useful in terms of potentially increasing the sensation. I always tell people, whatever you're going to try on the genitals, make sure you try it elsewhere, your hands, your arms, whatever, to make sure you don't have an allergic reaction. But I find that those are, good places to start. And then if you're still struggling, like talk to your doctor, because at some point it may be that there's something else going on, something that's changed, something hormonal that we could optimize that may help you regain your orgasm if you've lost it, or help you figure out why you are having difficulty getting an orgasm. The last thing I will add is that you need to be mindfully present to have an orgasm. When you have an orgasm, that's the moment where you are literally cannot think about anything else. You are the most mindful. And so in order to get into that headspace, you need to not be thinking about all the work you have to do, all the laundry, whatever it is you've got going on, your kids, your parents, like you got to be focused on yourself. And so that may require work outside of stimulation. Like you may need to pick up a mindfulness practice or just try to allow yourself to not think about other things. And maybe that means you take a bath before you stimulate yourself or something to sort of get yourself in the mind space of just being with yourself and not thinking about other things. And that takes practice.
Yeah, and as you were talking about that mindfulness aspect, I couldn't help but think about how women are kind of culturally conditioned to think about and attend to other people's needs and to put other people's needs ahead of their own. And if that sort of mindset carries over into the bedroom and you're only focused on your partner's pleasure and you're not thinking about your own, that can make it hard to get into that state where you can let go and focus on your own pleasure and have an orgasm. And so there is something to be said for being a little bit selfish in bed and focusing on your own pleasure, because you need to allow that opportunity for orgasm to set in by getting in that right headspace.
Yeah. And I think realizing like you're not broken. This is a skill that everyone needs to get and practice and attain. And, some people get it easier than others, but that doesn't mean that like just because you haven't had an orgasm or maybe it's become more difficult that you can't get that back. And, mindfulness has been shown even in scientific literature to improve desire. So we know that women who do mindfulness practices have better desire for sex. And so it can improve your life in the sex domain, but also in a multitude of other areas as well.
Yeah, absolutely. So we've talked a bit about pleasure. Let's talk about sexual health. Now, a lot of women seem to be concerned about vaginal hygiene, specifically with regard to issues surrounding vaginal smell and taste. And this is part of the reason why there's this big market out there for vaginal hygiene. But of course, those marketers have spent years, decades, trying to convince women that there's a problem down there. I mean, I remember seeing those ads all over television when I was a kid for douches, where there was this girl who was asking her mom, "Do you ever feel not so fresh?" And, I had no idea what they were talking about at the time, but it's easy to see how the pervasiveness of ads like that have convinced generations of women that their vaginas aren't quote unquote fresh and that they need to do something about that. So I'd love to hear a doctor's take on this. What do you want women to know who are concerned about things like vaginal taste or smell?
So I will tell you very clearly, your vagina does not need to smell like a pina colada, like a key lime pie, like peaches, like any of those crazy things that people are selling you. Your vagina is a self-cleaning oven, meaning that you don't need to douche. You don't need to do anything inside the vaginal canal. In fact, doing those things can cause harm. They can disrupt the normal vaginal microbiome, and just to let you know, if you are feeling like you are insecure about your scent, this is a very common sexual insecurity, and it's perpetuated by media, right? It's like you should smell great, or everything about you should smell a certain way, right? But our own body creates a scent, and that scent is actually quite arousing to men. If you're hiding that, you may actually be limiting that arousal factor from your partner. In terms of hygiene, you should wash the hair-bearing areas with a mild, sensitive skin soap, or even like a facial cleanser, which is meant for sensitive skin, can be a great idea just to clean the hair-bearing areas. So the mons, the areas, the labia majora that are hair covered, you can wash those with soap, let soapy water run down, and that is all you need to do. Your body will take care of everything else. Now, if you have an odor that is fishy or bothersome, please see your gynecologist or your primary care doctor to make sure you don't have another infection. But all those things aside, you don't need to douche. You don't need to do anything else. No vaginal steaming, none of that stuff to optimize your vaginal hygiene. That is unnecessary and potentially harmful.
Yeah, I think that's all great advice. And yes, please do not steam clean your vagina. This also has me thinking about how far back this all traces with feminine hygiene. There were advertisements back in like the 1930s and 40s, I believe, for Lysol being marketed as a feminine hygiene product. And they were trying to tell women to literally put Lysol in their vaginas to freshen up. And it's like, holy shit, like what a terrible idea. And that's just absolutely not something you should be doing. But it just goes to the heart of the problem, which is that media and marketers have just been trying to convince women that there's a problem. And they've often been selling them solutions that are going to cause more harm than good in terms of their own health.
I mean, we've been told as women that we're dirty for centuries, right? Like vaginal bleeding, menstruation you got to conceal it, you got to hide it. God forbid you have an accident in school. It's just this thing that you're taught from a young age, and it's very pervasive. It's not your fault that you believe these things, right? I just want to be clear, it's not your fault that you think you need these things. People, society, media has ingrained this into your brain. And so, learn the education, know it's not necessary, continually remind yourself, and it will take time to decondition that. There's people, I tell them, don't take the shower head and get all in there. You don't need to. Yes, you should clean the folds. You should clean, in between the folds, you should clean the hair bearing areas. That's it. You don't need to be putting your shower head into the vagina and clean. You don't need to do all that. It's just a matter of there's nothing you're doing that's causing a problem as long as you're not doing those things, right? And sometimes if your smell changes, it's going to change. If you eat certain foods, if you drink certain things, you may notice a change in your odor, right? Because it's changing your microbiome. Everything you do all the time is changing your entire microbiome, your skin, your gut, your vagina. And so maintain a healthy body weight, maintain a healthy diet, drink lots of fluids, stay hydrated. Those are going to keep your odor smelling the best possible.
So since you brought up vaginal infections, I just wanted to ask a quick question about that, because we know that most women will experience a vaginal infection at some point in their lives. Sometimes you'll have an infection and you don't know it. Sometimes you'll think that you have an infection when you don't. Sometimes some women are predisposed to having recurrent vaginal infections. So I guess my question is just sort of, how do you know whether or not you have an infection, and what should you do if you have recurrent infections to try and prevent them?
Yes. So one, obviously, if you have any symptoms, itchiness, burning, pain, new discharge, a strong change in odor, those are reasons to see your doctor, because they will do swabs and different things to assess for infections. They may send your urine, they may send a swab to just check for infections. If you've had unprotected sex and you're concerned about infection, get that checked as well. If you are having other symptoms, sometimes it can be dermatologic. So what I find a lot of the times is people think they have infections. They are very aggressive in washing because they feel like they're doing something wrong. And then their skin gets very irritated, even sometimes gets dermatitis. And then they're having itching and discomfort. And but the infection keeps coming back negative. So that's one thing. And then sometimes they really have a dermatologic condition, like they have a lichen sclerosis or something of that nature. And that needs actual treatment. So sometimes if you're like, you know what, I've I've tried the gynecologist, I'm not getting results, maybe see a dermatologist, talk to your primary care doctor. Every doctor doesn't know everything, right? And so sometimes you'll be like, I'm struggling. I still feel this way. I don't know what's going on. It may not be a vaginal infection. It may be, a dermatitis or something of that nature. Now, if you're getting recurrent infections that are proven, very commonly we see like bacterial vaginosis or recurrent urinary tract infections, that's where, you need to talk to your doctors. There are different options available. I mostly treat recurrent urinary tract infections, so I'll talk about those. For bacterial vaginosis, I've had some success with boric acid suppositories, but again, start those with your doctor's approval. For recurrent urinary tract infections, I will say one is hydration is super important. You know that increasing your fluid intake, increasing by 1.5 liters a day will decrease your risk of recurrent UTIs by about 46%. So that's really, really powerful. The other thing is if you're constipated, making sure you're treating that, because when you're constipated, you put yourself at higher risk for recurrent UTIs. If you are having other things that can irritate the bladder lining, sometimes that can mimic an infection. So caffeine, alcohol, citrusy fruits and juices for some people, spicy foods for some people, those sorts of things can sometimes irritate the bladder lining. If you're smoking, that can irritate the bladder lining. And then in terms of other things you can do is making sure you're emptying completely. So if you're like rushing and peeing real fast or you're hovering over the toilet, sometimes your bladder may not empty completely. So making sure you sit, you bend over a little bit, maybe you pee fully, you relax your body, maybe stand up, walk around, sit back down and pee again. Make sure you're fully empty, because if you leave anything behind, that's food for bacteria. And then seeing your doctor to make sure that every time you're getting these symptoms, you're truly getting a UTI, because there are things that can mimic urinary tract infections, one of which we mentioned earlier, which was pelvic floor dysfunction. And that's not an infection. And you don't want to be taking multiple courses of antibiotics if you don't truly have an infection.
This is all great information and advice, and I really appreciate you sharing all of this, Rena. I'm so looking forward to the next episode when we're going to dive into men's sexual health and pleasure.
Can't wait.
Well, thank you so much for this amazing conversation, Rena. It was truly a pleasure to have you here. Can you please tell my listeners where they can go to learn more about you and your work?
Absolutely. You can find me. I have my own podcast, Rena Malik MD podcast, where I talk about sexual health and other health issues. I have guests as well as do some solo podcasts. I also have a YouTube channel, Rena Malik MD, where you can find unique content from me as well as the podcast episodes in video form. And you can find me on any social media platform, Rena Malik MD, except for Facebook, where it's Dr. Rena Malik.
Well, I will be sure to include links to all of that in the show notes. So thank you again so much for your time. I really appreciate having you here.
Thanks for having me.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology Premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.